Welcome back. Well, today we're joined by two distinguished guests contributing significantly to the fight against cancer, particularly prostate cancer, which continues to impact the lives of many across Africa and beyond. Dr. JS Spiegel is a medical doctor with a strong focus on patient care, public health advocacy and cancer awareness. And she's passionate about promoting early detection and equitable healthcare. Lukas Neidlein is a people developer at the German Cancer Research Center, where he empowers professionals and researchers through capacity building, leadership training and cross-cultural knowledge exchange. They're both here this evening to talk to us about the lead up to the first Southern Africa Prostate Cancer Summit that will be taking place in Namibia from the 15th to the 17th of May. Ladies and gentlemen, good evening and thank you so much for joining us.
Thank you.
I'll also start with Dr. Spiegel. Perhaps you can talk to us about why, prostate cancer is often diagnosed very late within African countries, and why early detection of this disease is so important.
Okay, so in order to start off with why it's diagnosed so late, we just have to look a little bit at the risk factors. I think that helps guide us a little bit. So in terms of it, it has to do with knowledge, first of all. Not a lot of people know about prostate cancer and what the signs and symptoms of prostate cancer is. I think I'll touch a little bit on it a little bit later. And then also, then it has to do with how often, like when they need to present. It has to do with genetics. So it's more common in those that are from African descent, especially those that are of Black heritage as well. It also has to do with issues where what your diet is. If you can remember before, we ate a lot of a lot of vegetables and fruits, but now with the change of our diet, where we have more westernized diet, that also has impacts on the amount or the number of prostate cancer cases that we've had recently. So once you've looked into those things, and one important factor that I must mention is the men don't have that normal urge to show up when they're feeling bad to the hospitals and to the physicians. So they tend to be like, I'm a man, I'm going to deal with it myself. So it's poor health-seeking behavior. Yes. So that's one of the core problems that we have as well. So now once you see that, then you might be able to target some of those issues that they have. However, if you do present early enough, then it changes management completely. Then it becomes, in the first stage, if it's not metastatic, it's curative.
Please say that in layman's terms, expand
so
on that.
So then it means that we can actually cure the cancer if it's early, before it has spread elsewhere, if it's limited to the prostate itself. However, if you do present later, and this is only achieved by screening. So if you come in early and we screen you, we can detect it early, and that way we can basically cure your cancer. However, if it's now spread, and it loves spreading to the lungs, to the liver, as well as to the bones, then it means that we're not going to cure, but what we rather do is that we would just help with alleviating of pain symptoms and slowing down the progression of the cancer. So that's the two important things with why you would want an early detection versus a late detection. So this whole summit is aimed at trying to get the knowledge out there, trying to get people to know what are the symptoms, when you should present, where you should present, and then also getting the challenges that we as health professionals are facing, also pick up on those and see how we can change that in the dynamics of Africa, in the surroundings of Africa as well as Southern Africa, and see how other countries are doing it and maybe adapt those if those are changes might help.
I want to come back to something that you mentioned in terms of early, having early or late detection and what, the contributing factors are. Because a lot of doctors will say that, either the traditional norms or the stereotypes around men accessing healthcare is what prevents them from going to get help in the first place. Like, it's just not, men don't go to the doctor.
No, they don't.
So I want to circle back to that a bit later on. But Lukas, just talk to us about how the work that you do better supports, health outcomes in cancer research as well as with cancer treatment.
Yeah, so basically as a people developer, what I do is I support our scientists, our doctors that are in the fields, that are on the patients. And I think a lot of times the specialists, they know their area, they know their work, and they're very good at it, right? They are the ones who really try for change. And where I come in is basically, I see myself as the middle part between them and the outcome or the patients a lot of times, where they have to make this knowledge transferable in understanding what these people have, because a lot of times they are in their medical world and for them it makes total sense, or in their scientific bubble, and I'm like, but this is not a case, this is a person now, so we have to make sure that it reaches the people directly and they do understand it, because sometimes also this fear that comes with going to a doctor is the fear of not understanding it and feeling helpless there. So I come in and then I support them whenever they need, mostly likely with soft skills, that they can reach these people better and to make their great work that they do shown and reached.
Well, Dr. Spiegel, back to what we spoke on earlier, you mentioned that the conference really, in a nutshell, is to bridge that knowledge gap between, you know, the patients and the specialists and on this disease specifically. And it's all good and well. You can inform them, you know, that their diets might have impact, that it might be hereditary, etc., as you mentioned. But how do we, you know, bridge the gap with these, like I said, traditional cultural norms that prevent men from going to seek help?
Yeah, and I think with that, obviously, you know, it has to do with us talking to each other, and women also play a huge role in this as well. In terms of you, when you're at home and you're there with your uncle or your brother or your son, basically making it a normal habit to say, if you don't feel well, this is a place where you go and you do seek help. So if we start with the young ones and start teaching them that it's okay for men to go out and go seek help, it's okay to, if you don't feel well, ask for advice. So then if we change that, and also with the new changes that we're doing, making medicine more accessible to people, and then computers and research online that is also helping people be able to bridge the gap where you don't maybe have a book, but you have a device where you can read up, okay, maybe the symptom, you're not going to get everything. And I'm not saying let Google be your doctor, but there are a few things that you can, places where you can go, and even to your nearest clinic, ask a nurse, that's the start, and then maybe move on from there. Should I get some other help? But if we can change, make it more normal for men to seek the help, and then also to know when to come. So with prostate cancer specifically, it has to do with some urinary symptoms that you have, for example. I want our community members to know that if a man is having problems with maybe passing urine, has to wake up 3-4 times at night in order to go and pass. That's not normal to wake up that many times to go and go to pass, to urinate, basically. Then also having to push when he's urinating, or that he's having interrupted stream. It starts and it stops. Those are called obstructive symptoms. They are not normal. Then you need to seek some help. On top of that, if you have severe back pain, where you literally have to wake up at night because the pain is quite unbearable. So it's also a symptom that you can have, and then weight loss associated with it. If you have a family history that your uncle or your father had prostate cancer, all of those are called risk factors that I was mentioning earlier. So put those together, then it means when you're aged 35, you should go in and go have a PSA done. Again, you mentioned something about stigma, and that is so true, because a lot of men don't want to come to urology or to have a prostate exam done, which is the digital rectal exam. And we've had these issues multiple times. But now we are so blessed that there is a PSA. It's called a prostate-specific antigen, right?
So they no longer do it the old way.
We do it together. They give a better prognosis, but we can do the PSA as well, because what we do what the patient requires or says that they want, or what they're comfortable with. So if you do a PSA, we still stand a very good chance, if it's done routinely, to pick up the changes that happen there, because there is a baseline value, and if you're higher than that, then we can know, okay, no, there's something we need to investigate. What's going on here? And that's what we're asking people to do. Go to your local cancer association. They do the PSA for free there. Go to your clinic, ask them, no, I'm 35 or I'm 45. If you don't have risk factors of a family, 35, otherwise 40.
So what's the age group you need to be aware of?
So if you have family history, 35. If you don't have a family history, from the age of 45 upwards, you come and then you just say, I want a PSA done so that I can see if I'm at risk or not. Then they will do the blood test, and based on that, we move to the next steps or see how we're going to proceed from there. So that's how it works. It's very important that we just start that, because we don't really have the totals. Surprisingly, since November of 2024, prostate cancer is now the #1 cancer in Namibia. So we've surpassed even breast cancer or cervical cancer in Namibia at the moment. And this is really sad and disheartening for our men.
Lucas, Dr. Spiegel mentioned earlier that women, also can play a role in getting men to come and, seek medical help. Do you agree with those sentiments?
Oh, definitely. We just had a wonderful experience in the changing room here. There was a woman, I think she will be on another show later on, and she said, "Oh, that's fantastic that you're doing that on prostate cancer, because I have to get my husband to do that." And I was like, yes, please do, because women are the stronger ones in that sense. So they have to kick their men to go to the preventative measures.
From a people development standpoint, Lucas, what qualities are essential when it comes to training healthcare professionals to lead change within their communities, especially when it comes to, bridging this gap, this knowledge gap on certain diseases?
I think it really comes back to communication. It does come back to cultural communication, right? Cancer is a global problem, and we have to address it everywhere differently. I mean, if you look at the cultural differences, they're so huge. And not just even within countries themselves, even within countries, right? You were talked about earlier about rural areas and capitals. So this is what we have to understand, and we have to address these needs and changes. And also on the terms of helping our professors, our people, our scientists to normalize it more, as Melissa already said. And I think this is a wonderful thing. We have to face it with knowledge and not with fear.
Well, of course, as I mentioned, the summit, first of its kind for Southern Africa, is happening here in Namibia. So we're very blessed to be able to host it. It's happening from the 15th until the 17th of May. I understand there's so many, experts that are expected to be at the summit. Talk to us a bit about, the speakers and the experts that will be, there, Lucas.
Yeah. Well, we really have the best of them, right? And we have the best people from Namibia, we have the best people from the region, we have people coming from South Africa, Senegal, whatever. We even have people coming from the UK and Australia. So this time it was really about expertise. Who can share the best knowledge? Because this is what science is about, right? It's not about collecting your knowledge and keeping it for you. It's about sharing this. We're all in this together. So let's do that together. So this is what I'm very thankful for. And also to share best practices, right? Yes. What does work somewhere else, and what can we maybe learn from them? This will be hopefully a huge output of our summit.
Fantastic. Well, just in closing, Dr. Spiegel, would you like to add on something about the event that's upcoming?
I would just like to say that if there's anyone that really wants to attend, the doors are still open. We're still going to allow for people to come through on the day to register, and there is an online registration as well. Please do come through. The more the merrier. And we're also going to look at other platforms that maybe we can share this on a later date with those that are not there and the mass public as well. But again, I reiterate, this will only work, and our skills that we're going to develop from this is only done so that we can better serve our nation. So that means our men, our women force our men get up, get tested. Let us do this so that we can bring down these numbers. Prevention is always better than cure.
100%.
Yes.
Well, thank you so much for being here.
Thank you for having us.
It was lovely having you with us.
Thank you so much.
We're going to be back right after this brief break. It's almost time to say goodbye. Not quite. We'll be back after this.